Whilst there are no direct flights from the affected region, there are indirect routes into the UK. So in the next week, Public Health England will start screening and monitoring UK-bound air passengers identified by the Border Force coming onto the main routes from Liberia, Sierra Leone and Guinea. This will allow potential Ebola virus carriers arriving in the UK to be identified, tracked and given rapid access to expert health advice should they develop symptoms. These measures will start tomorrow at Heathrow Terminal 1, which receives around 85% of all such arrivals across the whole of the airport. They'll be expanded by the end of next week to other terminals at Heathrow and Gatwick and on the Eurostar, which connects to Paris and Brussels-bound arrivals from West Africa. Passengers will have their temperature taken and complete a questionnaire asking about their current health, recent travel history, and whether they might be at potential risk through contact with Ebola patients. They'll also be required to provide contact details. If neither the questionnaire nor the temperature reading raises any concerns, passengers will be told how to make contact with the NHS should they develop Ebola symptoms within the 21-day incubation period and allowed to continue on their journey. It's important to stress that a person with Ebola is only infectious if they're displaying symptoms. Any passenger who reports recent exposure to people who may have Ebola or symptoms or who has a raised temperature will undergo a clinical assessment and, if necessary, be transferred to hospital. Passengers identified as having any level of increased risk of Ebola, but without any symptoms, will be given a Public Health England contact number to call should they develop any symptoms consistent with Ebola within the 21-day incubation period. Higher risk individuals will be contacted on a daily basis by PHE England. Should they develop symptoms, they'll have the reassurance of knowing this system will get them first-class medical care, as the NHS demonstrated with nurse William Pooley, and the best possible chance of survival. We expect these measures to reach 89% of travellers we know have come to the UK from the affected region on tickets booked directly through to the UK. But it is important to note that no screening and monitoring procedure will be able to identify 100% of people arriving from Ebola-affected countries, not least because some passengers leaving the countries will not be ticketed directly through to the UK. So today I can announce the government will ensure, working with the devolved administrations, that there is highly visible information displayed at all entry points to the UK, asking passengers to identify themselves in their own best interests if they've travelled to the affected region in the last 21 days. This information for travellers will be available by the end of this week. We should remember that the international community has shown that if we act decisively, we can defeat serious new infectious disease threats such as SARS and pandemic flu. The situation will get worse before it gets better, but we shouldn't flinch in our resolve to defeat Ebola, both for the safety of the British population and as part of our responsibility to some of the poorest countries on the planet. Our response will continue to develop in the weeks and months to come, guided by advice from the Chief Medical Officer, Public Health England and the Scientific Advisory Group for Emergencies, and I commend the statement to the House.